Good morning, everyone, from Brussels. Welcome and thank you for joining us this morning on Friday the 17th. Today's topic is antibiotic resistance, and we will talk about the work of the European Centre for Disease Control. And we have with us this morning a wonderful expert from Stockholm, Dr. Dominique Monnet. He is the head of antimicrobial resistance and healthcare associated infections program at the ECDC, which is an EU agency based in Stockholm. Thank you very much for being with us today, Dr. Monnet.
Good morning.
Good morning. Is it all right if I call you Dominique during this interview?
Yes, sure, of course.
Perfect. My name is Kaisa and I'm the Director of Policy at EPF Secretariat here in Brussels. And the aims of our breakfast briefing this morning are to understand more about what antibiotic resistance is and to understand how patients particularly are affected by it and what we can do as patients and patient organizations to combat and limit antibiotic resistance. I would like to remind you that when you are watching this on YouTube, you can send us comments and also questions. We will try to answer them if we can, and in any case, the recording will be available later today on our YouTube channel. So maybe if we could start, if I could ask you to tell our audience a little bit about the ECDC and your work.
Yes, so ECDC is like you said, one of the EU agency. It stands for European Centre for Disease Prevention and Control, and has a mandate to work on prevention and control of only communicable diseases. Mm-hmm. It covers the 28 member states of the European Union, Iceland and Norway, and also can work with those countries that are either candidate or potential candidate to access the European Union and the neighbor countries. Okay. The mandate of ECDC is the risk assessment and risk communication about these communicable diseases. That means what we do is surveillance. We make sense of those data that are collected by all the member states, and we try to give an overall picture for the European Union. We also perform epidemic intelligence, and we perform rapid risk assessment about emerging communicable diseases. And then we also provide scientific advice that would have an added value if it's done at EU level, so member states can use it for their own guidelines. Okay. The risk management of those communicable diseases, the real prevention and the control, is the responsibility of each individual member state. Okay. So what we're really doing is support, coordinate action, so this risk management can actually take place in member states. For the area of the special health issues of antimicrobial resistance and healthcare associated infections, we also do surveillance, risk assessment, and risk communication. And tomorrow will be our 10th European Antibiotic Awareness Day. Indeed. Which is one of the communication activities that we're doing at ECDC.
So when you say surveillance, I take it that it involves a lot of data, a lot of collection and interpretation of data.
Sure, there is continuous collection of data that is taking place in the different member states, and these data, as per the legislation, are sent to ECDC, and ECDC makes sense of those data. Okay. For antimicrobial resistance and for antibiotic consumption in humans, these are published every year in November on the occasion of European Antibiotic Awareness Day.
Okay. The topic that we have is not new. Antimicrobial resistance is not a new thing. So why is it now so much an urgent issue and on the policy agenda?
Well, compared to other issues on this planet, antibiotics is a new medicine. We started using antibiotics, starting with penicillin a bit more than 70 years ago. And as soon as we started using antibiotics, or even just before, because they were already used and there are antibiotics in the environment, researchers started to describe resistance to those antibiotics in bacteria. So researchers developed new antibiotics that were active against resistant bacteria, and these were marketed and used to treat patients. And we've been lucky to having been able to spiral up, always having access to new antibiotics, even more powerful antibiotics that we would be able to use. Now, the past 20 years, I've seen very few new classes of antibiotics being marketed, and there are not so many and new novel antibiotics with a novel mechanism of action that are in the research and development pipeline, which means we reduce of using the antibiotics that we have, the last line antibiotics that we have, and we know that resistance to the last line antibiotics has developed, in particular in those bacteria that are responsible for infections in hospitals and other healthcare settings. So we're running out of weapons in a way. And if we're not more prudent at using the antibiotics that we have so far, and if we're not better at preventing transmission between patients of resistant bacteria, well, then we'll run out of options for treating patients.
Okay. So essentially it's always been like a race between the bacteria and new antibiotics, and now we don't have that option of new antibiotics
Sure.
anymore.
And bacteria are smaller, adapt much faster than we're able to adapt. So it's part of the equation,
Yeah.
and we need to take this into account. They will always be resistant to antibiotics.
It's in the nature of things.
Yes.
So can you explain to our audience why and how people actually develop resistance to antibiotics? Because often people say, I have become resistant. But it's not exactly how it works.
Yeah, it's a misconception. We as human beings are not becoming resistant to antibiotics. It's actually the bacteria that are on the surface of our body, or the bacteria that are responsible for our infection, that become resistant to the action of antibiotics. So imagine that we start with our good bacteria in our digestive tract, and then on our skin, and because there's an indication for taking antibiotics, we receive those antibiotics. What will happen is that the good bacteria will be eliminated.
Also.
And if we are carrying a few resistant bacteria, they will be selected. So that's what's happening. And we all have been taking antibiotics, and we know the effects. The effects is, well, I have discomfort in my belly. Or, you know what, I took antibiotics and I had diarrhea. I took antibiotics and I had candidiasis or candidosis. Or I took antibiotics and I had a severe case of diarrhea, and I'm thinking here about patients exposed to antibiotics in hospitals, and I have Clostridium difficile infection. So life-threatening infection. So every time we take antibiotics, this has an effect.
Okay. So how big is the problem currently, and what is it that we are actually risking? What I'm trying to get us is how concretely the resistance can have consequences for patients with chronic conditions, particularly.
Well, in general, at one point we try to compare bacteria or infections due to bacteria that are resistant to multiple antibiotics and compare this with other diseases. So we try to estimate the number of deaths every year in the EU that are attributable to, we picked just 5 multi-drug resistant bacteria and 4 main types of infection. And from those calculations, we estimated that 25,000 Europeans every year die as a direct consequence of the infections due to a multi-drug resistant bacteria.
25,000.
25,000 every year, which seems small compared to other disease, but still it's in the same range as people that die every year in the EU from traffic accidents. Or if you want to put it really in blunt terms, is 2 medium-sized airplanes that would crash every week, nobody would survive, and again the next week, and again the following week. Of course, these deaths are not happen in the same location and at the same time. They happen in different probably hospitals that are scattered all over the EU. But the number is consequent. These estimates were published by ACDC in 2009, and we're currently working at revising those estimates. Now, the second consequence, not all patients that have infection due to multi-drug resistant bacteria die. But they will probably, if it happens in a hospital, they will stay longer in the hospital. They may be out of work for a certain amount of time. When they return from the hospital, they may have consequences for possibly many months and possibly the rest of their life. So as part of our new estimates, we also estimate the consequences that are not directly attributable to death, but also the impact of those other consequences.
So you said a little bit about the work of the ECDC. I don't know if there's anything you would particularly want to elaborate on what you're doing to combat resistance before we go into what political decision makers should be doing.
Well, as I explained, our mandate is really to support member states, make sense of those data, and make sure that what we do as an EU added value. I mean, it's work that makes more sense when it's done at EU level to support member states rather than done individually in each member state. So means we recently published an ECDC guidance on what are the infection control measures to prevent spread of a multi-drug resistant bacterium resistant to last-line antibiotic, carbapenem resistant Enterobacteriaceae, when they're introduced in a healthcare setting because a patient is transferred, are to make sure that the patient will be properly identified and isolated to prevent spread to other patients. So we published a guidance, and member states can now use this guidance, hospital can use this guidance to make their own national, regional, local guidelines.
Okay, so this is a very practical tool that you've developed.
So we also have a directory of online resources for the prevention and control of different multi-drug resistant bacteria, for infection control practices, for antimicrobial stewardship, training opportunities, action plan in member states, for example. This is available from the ECDC website. And we have a database, interactive database with the data on antimicrobial resistance surveillance, antimicrobial consumption surveillance in humans. And then finally, we have a specific website for European Antibiotic Awareness Day with resources in all the official EU languages of EU member states that can be accessed from that website.
Indeed, and this is an excellent website. I would encourage everyone in our audience to check it out, because there is a lot of information on the site, also infographics, posters and practical tools.
Thank you.
And we'll come back to that, I think, in
Thank you.
as well.
Now, you had a question on how does all this affect the patients that are the members of the association, that are members of the European Patients Forum. Your members of those patients, they're special patients. They're more vulnerable than other patients. And I will pick a few examples. Patients with diabetes often have infections, skin and soft wound infections, skin and soft tissue infections. And they will require antibiotic treatment if they have an infection with a bacterium that is resistant to multiple antibiotics. Treating these infections will be difficult.
Yes.
We know that having received antibiotic treatment, we know that it affects the gut flora, but there are now studies showing that it may affect the effectiveness of those immunotherapies that are used to treat certain cancer.
Really?
Yes, I mean, this is recent data. We know, so vulnerable patients are more like patients with, for example, cystic fibrosis, are patients that will often get lung infections and they will require effective antibiotics.
Yes.
patients with chronic conditions are more likely to be admitted to a hospital.
Exactly. Yes.
So they will be more likely to receive antibiotics in a hospital. They may, unfortunately, in some cases, get a healthcare associated infection and will require effective treatment. Another recent study shows that patients that in a hospital have been exposed to antibiotics, in particular those antibiotics that really affect the normal digestive flora, or called broad-spectrum antibiotics.
Could you briefly explain what broad spectrum means, just for the
Well,
viewers who
it's a term that is not correct, and there are many definitions for it. But let's say antibiotics that have such an effect on bacteria that they will really affect the normal digestive flora.
Okay.
So those antibiotics are mainly used, they can be used outside of hospitals because they are oral forms for their administration, but they are mainly used in hospitals. So having received such antibiotics, and after having control for all other cause of having a severe bloodstream infection that caused malfunctioning of the organ, and we call this sepsis.
Yes.
And with very low blood pressure, it can evolve into what we call septic shock. Just having received those antibiotics, and especially the broad-spectrum antibiotics, will increase the chance, once you've controlled for all other risk factors, of getting sepsis, or
Which
severe
is a
sepsis or septic.
life-threatening
This is a new, yeah, sure. This is a new a new study. So
That should be worrying to everybody who is with in a regular contact with healthcare organizations.
Sure. I mean, colleagues in hospitals all over Europe are doing their best to prevent cross-transmission with infection control practices, and to prevent cross-transmission, and to isolate those patients that are carriers of multi-drug resistant bacteria, and at the same time work with antimicrobial stewardship. But there's still much more to do.
Yes, indeed. Well, thank you for outlining in such clear terms the extent of the problem. Now, when it comes to policymakers and our politicians, we are patients, but we are also citizens. So I would like to hear from you what the decision makers ought to be doing. If you had to give me top three urgent actions, what would you say?
Well, as an EU agency, we cannot tell the policymakers what to do, and actually they have done many things in recent years. You know that there's a new European One Health action plan against antimicrobial resistance that was published last July. It comes with a set of EU guidelines for the prudent use of antimicrobials in human medicine. The EU already had guidelines for prudent use of antibiotics and antimicrobials in veterinary medicine. Now we have the same ground rules on how to use antibiotics prudently in human medicine. All this was published last July.
Yes.
In 2015, the WHO started working also on a global scale with antimicrobial resistance and prudent use of antibiotics. There is a World Antibiotic Awareness Week, which is actually this week. There's now a global action plan on antimicrobial resistance that the member states of WHO the ministers have approved. Among these, it said that all member states of WHO should have a national action plan in a One Health perspective, addressing issues of animal health, but also human health, all the way to hospitals and other healthcare settings. So there are things happening. We have a basic document. Now, if member states implement those national action plans with concrete deliverables, goals, targets, and deadlines, things will change. We actually, I'm conveying not so good news, but I should also convey good news. We have evidence that when countries decide to do something and really put their energy and resources to do this, whether it's enforcing infection control in hospitals, or whether it's implementing public awareness campaigns on prudent use of antibiotics, for example, things change. Things may change quite quickly. There is a change in legislation, and this often happens in veterinary medicine. Things can happen with a national public awareness campaign on prudent use of antibiotics, and you may have seen those campaigns on TV channels, on billboards, on buses, everywhere in Europe. There are more and more of those, and the countries that have been successful, they show a reduction in antibiotic use.
That's a very good message, because we were talking a little bit before about climate change, and while there are some similarities between these issues, your message was that on antimicrobial resistance there is actually concretely more potential to reverse the trend. We can actually do some concrete things to improve.
Well, there are similarities. I mean, this is antimicrobial resistance or climate change. Both are complex problems with multiple factors, and that affect the whole society. But I think antimicrobial resistance, or what we were talking about, changing how we use antibiotics, something we can do immediately. We know that when there have been interventions, the interventions worked, and they can work even in wards, in hospitals, in countries that really have been struggling to control antimicrobial resistance. So again, if the resources are there, if the energy is there, if the resources are there, if the competence is there, things can change. The other difference is that what we do for climate change, we rarely see the immediate impact of it. Now, what we do on us, by not self-medicating with antibiotics, by discussing in an informed way with the doctor for us and for our children about whether antibiotics are needed now, or whether for this condition or this type of infection, actually we could wait a bit and maybe come back in 2 weeks if the condition does not improve. This will have not exposing ourselves to antibiotics or our children to antibiotics as an immediate prevention effect on our good bacteria, and preserved the action of the antibiotics on ourselves, our children, in the immediate future.
Excellent. That's a very positive message in a way that I'm getting here. Let's talk about information then, because in order to use antibiotics correctly, we need to have the right information. And there have been surveys to show that although most people know that overuse of antibiotics can make them ineffective, still almost half, at least according to a recent Eurobarometer, did not know that antibiotics are ineffective against colds, against flu. We always say at EPF that having access to reliable information is the cornerstone of patient empowerment. So, in your perspective, in your experience, what are some of the challenges, perhaps also opportunities of providing information to patients and citizens on this issue? That's also part of what you do as part of your awareness activities.
Yes. You're correct that about half of the Europeans, with large variations between countries, do not know that antibiotics do not work on viruses, do not work against a common cold, do not work when you have influenza. So the fact of not knowing means that there may be self-medication, there will be consultation to doctors that are not necessary. We have this, we've implemented, starting 10 years ago, this European Antibiotic Awareness Day, and there is material on that website that addresses the general public with simple statements in all the official languages that people speak in the European Union. Now, it's a complex message to pass through. And quite frankly, we explain antimicrobial resistance, but we immediately go to what antibiotics are good for and what they're not good for. That's one of the first things we say. Only the people that know about the website will access the website. Of course, we're in 2017. ECDC is active in social media, active on Twitter, active on Facebook, but still, you need to know that that Twitter account or that Facebook account exists to go there and say, sure, I will follow. I will follow what happens. Member states have implemented national campaigns in different ways. I think the most successful campaigns have been the campaigns with the TV spots.
Okay.
Short TV spot. This has happened in Belgium, in France, in Poland, in Greece, in Spain, with different messages. The good TV spots shown at the right time touch a lot of people.
Yes.
Still, they won't touch everybody. I asked a taxi driver one day in Brussels, did you see the campaign on TV in Belgium? And the immediate reply of the taxi driver is, no, I'm a taxi driver. I don't have time to watch TV. I was in my taxi. Now, if there had been a billboard just at the entrance of a train station, I would probably have seen it.
That's very good feedback.
And the other thing that he told me, he said, but what about radio? I'm on radio all the time.
Yeah.
So we need to first use as many channels as we can to pass the messages. Countries have used the buses, for example. A small country like Malta is using billboards because everybody's driving and at one point will pass in front of one of those billboards. I think language may be an issue. So we have an issue to reach everybody. The second thing is that we're trying to make everybody understand a relatively complex issue. And I think we covered it today in a nice way, but that necessitated a lot of words. And people don't have 1 hour to listen. So we have this issue. We may have issues of culture that are not being addressed, like we pass a message, but is the message really understood in that cultural context? And we need to make sure that the message in one country fit the cultural context and the social context in that country. Member states have been using the materials developed by ECDC in different ways to adapt to the cultural context.
There are also different expectations from people with regards to what they expect from the healthcare service. I
Definitely,
think,
depending on the country, and the campaigns need to address this.
Indeed.
But we'll have a challenge still to find a way to contact everybody and make sure that everybody understands what we're talking about. The good news is changing. Despite the wide differences in the knowledge about what antibiotics are good for and not good for, and what is antimicrobial resistant, is changing slowly, as shown by the Eurobarometer surveys.
Yes, absolutely, and certainly this topic is now on the agenda, both at the European level and I think in member states too. And we certainly as a patient community feel that we are particularly affected by it, so we should like to take action and also support you in your efforts. So what do you think we as patients, as patient organizations, and also as citizens, what can we do? What should we do?
I mean, as citizens, we're all concerned. As soon as we understand what antibiotics are, what is antimicrobial resistance, and what we can do, which means not self-medicate, and go see a doctor when in doubt, and have, based on this information that we received, have an informed discussion with the doctor and make a joint discussion about whether antibiotics are needed for that condition or infection. This is one thing we can do. And make sure to share the message with our family, with our friends, with the people we know. As an organization, I think what you can do is share patient stories. Mm-hmm. As part of the European Antibiotic Awareness Day website, we have a collection of patient stories. People that have had an experience with a difficult to treat infection and are courageous enough to go public and say, this is what happened to me. and one even say, this is the mistake I did. Okay, and this patient says, do not self-medicate, for example. So as patient organization, I think you could actually identify those patients that are actually willing to say, this is my story, this is how it affected me, and maybe this is what I've done, I should not have done.
Yes.
So that, I think these definitely speak to the larger audience of non-specialists.
You use patient stories in your work.
We started, I would say, a few years ago, and we appreciate how much of a difference can it make in passing the message.
It definitely gives a human face.
As a human face. I mean, we have stories that have been collected by ECDC, collected by other organizations, in particular in the United States, and they're all on the European Antibiotic Awareness Day website. We have about 10 stories now, but we'd be happy to have many more of those stories to make a case.
Great. I'll return to that point at the end. EPF has been supporting the ECDC campaign for a few years now. We've done a video pledge and we've disseminated your materials. We'll certainly carry on doing that, and you've just given me some further ideas that we need to work on internally to enhance the communication about this topic. Is there anything you would like to say to our member organizations, whether they are disease-specific, working at European level, or possibly national patient organizations in specific countries, in terms of what they could do in their own context?
Well, what I just said, I mean, identifying those patients that are willing to talk and say what happened to them is certainly something that can be done at national level and by the organization. And then I would say trying to identify for the disease that this organization is working with where prudent antibiotic use would apply and where better hygiene would apply. This is something that we didn't discuss much, but this is the other very important ways that we have to fight antimicrobial resistance. It starts with proper hand hygiene, means washing our hands in many situations in life to make sure that there are, I mean, it's easy to acquire a resistant bacterium just by touching a surface in a public space. So making sure that these resistant bacteria are removed, and there are situations where water and soap will not be available, and in those situations where hand washing isn't practical, we need to make sure that we have alcohol-based solutions for hand disinfection. They're available in small bottles. We can all have them in our pocket if needed.
Yes, and presumably the importance of hygiene interventions in a healthcare context, also in hospitals and in doctors' surgeries. We can all advocate for these practices. Certainly. Advocating for a more prudent use of antibiotics in hospitals together with a better hygienic precautions, or what we call in our jargon infection prevention and control, would certainly help. Good. That all sounds well with regards to the work we are doing on patient safety generally, which is a particular concern to EPF and to our members. Is there anything in terms of a final message that we will be wrapping up in a moment that you would like to convey to our audience? I think final words. I think we're all, I mean, we've covered a lot. We understand it now. We're all responsible. We are all responsible. Every one of us is responsible. Yes. I mean, we are potential patients. Many of your members are patients who are more vulnerable and have special conditions. We have children, parents that at one point may need antibiotics, so we're informed in that sense, and we may make informed decisions with the doctor about when or not to take antibiotics. And then there are people that have even another layer of responsibility, all the professionals
whether they're professionals in animal health, the veterinarians, the farmers, or healthcare professionals that either prescribe, use, dispense antibiotics. Well, that all these professionals, and that's me included, have another layer of responsibility.
Indeed.
But in the end, everyone is individually responsible. And if we add all these individual responsibility, I think we can solve the problem globally.
If everyone right now started behaving responsibly with antibiotics and with infection prevention, we could solve the problem very quickly, no?
I don't know about very quickly. I don't know about solving, but what we know is that those countries that managed to start with the public awareness campaign, and with this public awareness campaign, reduce the number of people that took antibiotics, they've seen not only a reduction in antibiotic consumption, but they also have demonstrated a reduction after a certain time of resistance in those bacteria responsible for infections outside of hospitals. Those hospitals, many places in Europe, that have managed to work jointly by reducing the duration of certain treatment, make sure that antibiotic prophylaxis for surgery is very short, as recommended in the guidelines, and improve at the same time infection control, they managed to reduce antibiotic use, and they managed to solve the outbreaks of multi-drug resistant bacteria.
So it can work.
It can work. It will probably take time, but there's certainly hope and things can be done.
Excellent. That's a very positive message on which to conclude.
Thank you.
I would like to thank you very much for being here and for explaining the topic to our audience. And I would like to encourage everyone to visit the website of the ECDC. I don't know if you have the website address in your head, but certainly can be found through Google.
ECDC is ecdc.europa.eu.
Yes.
And European Antibiotic Awareness Day also has its own website that you can access from the ECDC website.
Indeed. So do go and visit. The materials are there available in all of our languages. And also, if you do have a story that you would like to share, please do send it to EPF. We will treat everything very confidentially and would be happy to discuss with you if you would like to share your story for the purposes of helping the ECDC and antimicrobial awareness. So I think we can conclude here, and just to remind you, the podcast will be available on EPF's YouTube channel sometime today. Do subscribe to our channel, by the way, it's excellent. I would like to thank all of the EPF colleagues who have contributed to the streaming today, and also to let you know that the next breakfast briefing will be taking place on the 1st of December, and we will then be talking about health technology assessment. So thank you for watching, and have an excellent day and a very nice weekend.